There are
Yeah.
4 of us that were in the accident, and then 3 more kids that this affected obviously drastically. So
Yes.
there's
Yes.
7 people in my home that all function very, very differently.
Yeah.
And we hold space for that. We've learned how to hold space for that. And I'm always looking for ways that may help one of my kids differently than another, or that's going to help my husband, but it doesn't help me, or vice versa. And through this journey of both speaking and getting to interact with people in these professions, I have learned this very broad pool that exists of medical trauma.
Yes.
And I was actually on a podcast once, and she started naming it medical trauma. And I thought, I have never thought about that. I have
Hmm.
never thought about the fact that that's could be, what my label is or what I could identify with, because that is a lot of what's happened, right? We went through something that was very traumatic that caused a lot of medical treatment, and
Yes.
that we continue to live in that world, right? We are with healthcare all the time.
Hmm.
And it's been really amazing to be able to connect with and learn about the things that help us and the things that help other people, just for this. And then I have other medical things in my life as well as my loved ones. And so just to be able to learn how to help and how to empower myself with the tools and tricks, even just like you just did with straw breathing. It's an incredible way to be able to get through life when you go through something hard and it affects you so drastically
Yes.
that you can do something, right? And that empowerment piece is something that I'm all about, whether it's empowering the healthcare world and letting them know you are seen and you are valued and what you do makes a difference. You saved our lives. And
Yes.
they're not always able to, but they try, right? They do
Yeah.
what they can, and to empower them, and then also to empower patients. And a really big one that sometimes gets forgotten is to empower the caregivers. Those
Yes.
caregivers are carrying that feeling all the time. And I've seen
Yes.
that in my own circles, right? Like I was a caregiver, obviously, as well as a patient. But then my circles of my immediate family and my extended family and my closest community and my where I worked, all of those things, this affected everybody. I mean,
Yes.
everybody knows what happened to us because it was a big, big deal. And
Yeah.
so recognizing and empowering the waves that this creates. And I don't want to say that they're negative, I'll say that they're challenging.
Yes.
And then the waves that we can create in helping people to understand what to do with that and
Yeah.
how to take that and utilize it in a way that they can move forward with so they're not so stuck.
Right. Yeah. Because that feeling of being stuck is so common after trauma. Yeah. So I love that you're doing that. I feel so strongly about it, just to give people things that can be done. Because also part of healing from trauma is starting to feel that sense of agency, that autonomy that we lose, right? When we are in a traumatic experience, there was very little that could be done, right? For y'all to avoid that car. So you don't have the control you wish you had in those situations. And so as we're healing from situations we did not have the control in, that starting to feel that sense of, oh, I can acknowledge how I feel. Okay. And then I can make a little shift. I can take a breath, or I can go for a walk, or I can do some somatic shaking, or I can call a friend, I think is really powerful. It sounds simple.
It does.
Yes, but sometimes the most simple things are so incredibly powerful and can shift somebody's experience.